Hello everybody, just another really quick video in the car, sorry about this. Look, I've been asked recently by quite a few people about what are you doing in Australia for long COVID. As some of you are aware, I've recently spent nearly 2 months helping to start up a new long COVID service in Sydney, and I can tell you that long COVID is a thing. Anyone that tells you that it isn't, is not giving you the correct information. Now, there is no one single treatment for long COVID. Long COVID, potentially symptoms are varied. Some people might get cognitive dysfunction, so issues with short-term memory, issues finding words in sentences, problems focusing at work, problems remembering things. Some people get issues with breathlessness. Some people get problems with clotting, blood clots. Other people can have cardiac issues, other neurological issues, swelling in the brain, gastric issues, a reoccurrence of dormant viruses. There are literally hundreds. I think it's about 200 different noted symptoms that some people get. So what have we been doing? So basically, in the services that are set up around the world, what we're doing in Australia and in other countries is having a multidisciplinary team. So you got nurses, doctors, various types of doctors, physios, occupational therapists, all different types of people. And the main reason really is to get people assessed, try and validate that, yes, we know you have this condition. Now, long COVID is defined as you've had to have at least had COVID for at least 3 months, post diagnosis. Then you need to be having symptoms, some type of symptom that you didn't have pre-COVID after 3 months. So what we get people in is, for example, we would have a neurologist as part of the team. And if somebody's having like brain fog, what we might call it, any type of neurological issue, the neurologist would run tests and assessments just to make sure that there's nothing else going on, making sure that your memory issues are not caused by something else. So we're ruling out the usual suspects, so to speak. Then if there's anything noted that is different or new, we can try and treat that. But we're just trying to rule out other problems. An immunologist might look at people's blood results, making sure that there's not another condition arising or an infection that's brewing. And then if everything is reasonably stable, so there's no swelling of the brain, there's no issues with other viruses, then no lung conditions, all this type of stuff that specialists look for, then really it's just patience, it's waiting time, it's getting physical therapy, it's trying to get people to exercise safely, not doing too much, but enough so that you're actually not losing all your fitness and energy and strength, so that you can actually do things in the real world, dress, shopping, go to work, whatever it might be. You might have people that might have issues with speech, swallowing post-COVID. So an speech pathologist would be involved to see if there's anything actually physically going on, whether it is actually related to long COVID or not. And then if it is, then they can have certain treatments, certain tests and treatments. Want to make sure that nutrition is really good. Occupational therapists can be involved just to make sure that if you are struggling at home with energy, breathlessness, with showering, whatever it might be. We've had people in our service that have had issues with dizziness since they've had COVID, and they've struggled with showering and things like that and getting dressed. Also, let's say that you're of working age and you can't go to work. Then you might need a medical team to write letters and liaise with your work to say, look, this particular person has long COVID, they cannot work 5 days a week, maybe your job could be modified or reduced days, and we can provide medical certificates for that, just to try and give you some support, because it seems that most people are responding to treatments, to gentle exercise, things like that, but it might take a year. Some people are you can take a year or two to recover from long COVID. So patience is important, but we need to rule out other medical conditions. So that's why other specialists, neurologists, respiratory specialists, cardiologists are involved. Let's try and rule out any other potential condition, and then if there appears to be nothing physiologically wrong that we can see, then it's about physical therapy, getting you fit, getting you strong, and trying to work on things like that. So that's the main treatments really with long COVID these days. There is no magic drug. There are a few drugs being trialled, some anti-inflammatory medications, but at the moment it's nothing that's actually been given to the patients. But if you do think you have long COVID, you had COVID more than 3 months ago, and you are getting any type of symptoms that are not normal for you, speak to your doctor, because long COVID is now defined as a chronic health condition because it lasts for longer than 3 months. So don't ignore it, and seek help if it's available. I'm happy to answer any questions or provide any details. I'm very experienced with long COVID. I'm not an expert. I don't think there really is anybody as an expert in long COVID, but I have treated more than 100 patients with long COVID over the last sort of year or two. I hope you're all well, and I will speak to you all later. Bye.